Okay, today's date is December 22nd, 2011. This is John Meyer.
Hello?
Hey, John.
Hi.
John, if you just speak loud enough so that they can hear you
Okay.
into the video. And John has been actually under care for about 5 weeks, and he's been doing his nutritional program for approximately 4 weeks, actually as of yesterday. John, would you just like to share your story?
Yes, my story goes back starting about 2.5 years ago. I started to have some issues with pain in my lower legs, both legs and feet, and became just really unbearable every day. And that started my journey trying to find out what was going on, which led me to probably a dozen MDs over time, neurologists who did MRI scans and couldn't find anything. And ultimately I was diagnosed with Lyme's disease and began treatment on that. The theory was it was Lyme's that was attacking my exoskeletal muscular system, causing the pain. Went through many different types of antibiotics, heavy antibiotics.
20 months, is that correct?
20 months of antibiotics, and my symptoms didn't get better. They actually migrated further to other areas of my body, knees, hips, elbows, and my days were just filled with pain. I was given pain pills to try and help with that, Vicodin, Neurontin, naproxen all at the same time. It didn't really touch anything, and my days just continued to deteriorate. About 3 or 4 months ago, the problems moved into my hands and fingers, and I work with computers all day, have for 30-some years, and it became to where I couldn't do my job. Extreme sensitivity in fingers and just touch, and my hands would hurt. So at that point I'd really hit rock bottom, and the MDs at that point felt that I needed to go to more antibiotics, which was basically get a PICC line in my arm, and I'd have go from oral to injected IV antibiotics. And luckily a few days before that happened, I heard from my insurance company that they weren't going to cover that procedure, and that brought me to recheck to see what else could it be. The MDs at that point sent me to a rheumatologist, and the rheumatologist said, well, you have fibromyalgia, and it was probably brought along because of your Lyme disease, and you should expect to be in pain every day of your life, and there's very little we can do other than try and teach you to live with your pain, and probably wouldn't work again. So it was definitely a low day in my life. A few days after that, we ended up talking to a trusted friend, another chiropractor, who recommended we come and talk to Dr. Joe, and that began my, really, to me, a miraculous turnabout in just a month's time here, to where I feel now like I've turned the corner and am making progress in getting back to wellness. We've done several things beyond some structural issues with chiropractic adjustments with my spine. I've also found that I have some food intolerances to gluten and other things that we're addressing with a 4-day rotation diet, and as well as heavy metal toxicity. I've got high levels of mercury, lead, cadmium, and thallium in my body, so we're trying to deal with that as well, detoxing that out of my body, and just getting used to a new lifestyle. And I'm pleased to say, as I sit here a month later, I'm not in pain as I was, and still got a ways to go, but I'm just so thankful that we came here and met Dr. Joe, and we began the treatment back to wellness.
John, can you just share too, what was it like sleeping at night? I think that's significant.
Sleeping was very difficult. Beyond the pain pills, I was given Ambien to sleep at night, and there was many days when I'd get to 8:30, 9 o'clock, and I just couldn't deal with the pain anymore, so I'd take the pill and it would put me out. But going out would be about 3 hours. I'd get sleep and I'd wake up in pain again. But I had to, for over a year now, I've had to put pillows underneath my blankets in the bed, because just the fabric of a blanket touching my feet would drive me crazy. So very difficult, to say the least. I've had to wear shoes that are 2 sizes too big, and even at that point, usually would have to take my shoes off when I'm driving and things. So
Because of the discomfort.
because of the extreme discomfort of my feet.
What's that doing right now?
Right now, I'm sitting here and my feet don't hurt. My toes don't hurt. They're a little sore, but after 2 years of this kind of pain, I'm sure that's normal. But
You can wear your shoes again?
I wear my shoes, and I sleep. I've slept for close to 2 weeks now without any pillows in the bed.
And what about sleep meds and sleep aids?
Sleep aids, I'm no longer taking any medications, no pain pills, no...
You're 100% medication free?
100% medication free.
As of when?
As of close to a month ago. So
That's tremendous.
And I'm also pleased to say that I'm sleeping many nights close to 8 hours a night.
And how long has it been since you've been able to sleep without any medication support and actually sleep?
Close to 2 years.
2 years.
Yes. So the change has been tremendous.
Anything else, John, that you would like to share with future patients, or do you have any advice for future patients?
Don't give up. There's help out there, and sometimes you need to just keep digging and keep looking and be willing to consider other things that you may not think would affect your health, such as food and heavy metal and these types of things, because it can make a huge difference, and I'm evidence of that. So
you're telling people to be willing to think outside the box?
absolutely, absolutely. I've spent countless hours sitting with MDs, and I was put in a box, and it's refreshing now that I feel like I'm out of the box.
John, Merry Christmas.
Merry Christmas to you.
John, do I have your permission to share your story with future doctors, patients, or students anywhere?
Absolutely.
John, are there any restrictions on that?
No.
Thank you so much. We're going to check in again with you a couple months down the road, and hopefully we'll even have more great results to hear.
Very good.
Thanks, John.
Thank you.